Welcome to episode 213, Time Awareness and Neurodivergence, Insights and Interventions, featuring Robin Abbott, Occupational Therapist. Make sure to subscribe to be alerted about future episodes by Clearly Clinical. Learn, grow, shine. Hello to our listeners. My name is Beth Irias, and I am so happy to be joined again by Robin Abbott. She is an occupational therapist, and she has previously joined us on the podcast, and I'm so happy to have her back today to talk about something that I feel like we don't talk about near enough, which is time awareness and the concept of time blindness. Thank you so much for joining us today, Robin.
Thank you for having me back. It's always fun.
So for our listeners who are not familiar with you and with your work, please tell our listeners about you and your background.
I was an occupational therapist back before you didn't even need a master's degree to be an OT. So from the Stone Age, I worked with adults for a long time in acute care. And about 15 years ago, I started working with kids from a sensory integration framework for the most part. And that was really what I was supposed to be doing anyway. Primarily working with kids with autism and ADHD and sensory integration problems. And the more that I worked with kids from a sensory framework, the more I realized the importance and really the paramount importance of the auditory and vestibular systems. And they're hidden, and we don't realize all the things they do for us. So as I explained to parents and other practitioners, this is what's actually what I think is actually going on with your child. They wanted to hear more. Parents wanted to hear more. And really what I was explaining wasn't how their child developed. It was how all of us develop, and the importance of those two systems in creating development for us. So, that's the pulpit I'm preaching from almost all the time is auditory and vestibular awareness and how it impacts our function, both for the neurotypical and the neurodiverse population.
Amazing. Thank you for joining us. I know for me, speaking as a mental health clinician, it's so helpful to hear from other practitioners because we all have this lens that we view things through. And in our prior conversations about this phenomenon of time blindness, it just seems like something we clinicians need to know more about because it's coming up. I mean, heck, clients show up consistently 14 minutes late, and it's like we are quick to perhaps observe and comment or interpret when there may in fact be something entirely different going on in their minds. So why don't we start by an explanation and exploration of what is time, tiny topic. What is time and how are we aware of it in terms of perception?
Okay. Well, I've got, you've kind of got the developmental lens because I worked with kids. So I'm always looking at how their concepts of time develop. And then there's kind of the other topic of what does time mean to us as fully formed people for the most part. Time development with respect to all human beings starts in the womb. The concept of understanding time starts with the heartbeat of the mother, which is almost purely auditory. Yes, the child can probably feel something inside the womb, but that rhythm provided by mom's heartbeat is our first introduction to the concept of time. And it's purely an auditory function. And it's one of the reasons when babies are born, they have a concept of time based on rhythm. And we know this because if you play a rhythm for an infant, a newborn, and you disrupt the rhythm, it creates a neural peak for them. It creates new synapses in their brain going, wait, there was a violation of what I was expecting. So they already know how to measure time before they have words for it. I'm measuring the time between these beats and you violated the time. What's up with that? So that's the very beginning. And then, baby is born and time starts to take on a different meaning. Children are born with an innate organization around other people's voices. They are drawn to voices within the environment for a number of auditory reasons. But instead of just thinking, okay, these strange sounds coming out of this person's mouth are just for fun, it actually means something. And what starts to create that meaning in speech is time, and inflection to some degree. But if you think about emphasis when we speak, both drawing out the length of time a word takes to say increases emphasis and understandability, and also taking a significant pause increases our attention. It violates those rhythmatic rules that children have learned to establish in listening to speech. Speech is just kind of a whole bunch of patterny sounds for a child who doesn't understand the words. But when you start to violate the patterns, which we do when we speak motherese, when we make funny faces, it changes the rhythm of our speech as well. And so that's what gets an infant tuned in to that speech pattern. So that's how we use time developmentally. As we start to get a little bit older and we've developed the meaning behind some speech, there is an additional layer of emergency emphasis, I guess. I don't want to say emergency, but like emphasis that a person communicating with a child might put on what they're saying to emphasize the need for speed, kind of. And some of that comes with rapidly speeding up your speech. I mean, if you're talking to someone and they're a fast talker, you kind of feel it in your emotional gut a little bit. You start to get a little anxious because they're a super fast talker. And so we can start to key what we're saying into our emotions using time. So, the bottom line through all of this time awareness developmentally is that time is required using our auditory sense. Our auditory sense is the only sensory system that is time dependent. You can't understand what you're hearing unless you hear it in the context of time. So it would make sense that our auditory sense is the foundation of developing our time awareness. And because of that development of time awareness, we start to develop interpersonal connections. So it's kind of like the very most basic foundation for the things that come after.
Thank you. I appreciate that primer. And as you're talking about the rhythm, I'm just kind of hearing this metronome in my mind that's kind of the beat of our own drums, if you will.
Yeah.
So if that's developing over time from when we're in utero to, as you said, motherese, being spoken to a child and the differences in rhythm, as this develops into early teens, full adolescence, adulthood, I feel like tell me more about the developmental process, because here I am at this moment, a mother of relatively young children, watching different developmental levels in my house. I had a conversation today about how a minute is longer than an hour. And I'm like, I mean, it might be when I say in a minute. Yeah.
Is it a mom minute? We used to call those mom minutes. And do you mean 5 minutes or 5 mom minutes? And I was like, 5 mom minutes could take a while.
No, maybe I just got called out and I just only realized it right now.
So that's true. So, and that is one of the behavioral hallmarks that I look for in treatment is the understanding of a minute versus an hour. Especially for children who already have speech, for those children that already have speech and yet they don't understand those concepts. To me, that's like, oh, we need to work on your time awareness. We need to get that solid first. The other key component for me, both as an indicator during an evaluation, but also if it improves, I know I'm headed in the right direction treatment wise, is if they start to understand tomorrow versus yesterday, or when they leave my office and they're like, see you next week instead of see you tomorrow, because we don't see each other tomorrow, but we do see each other next week. And one of the other ones that I ran into a lot is for kids that have poor time awareness, and I'm talking like 8, 9, 10 age range, their parents are very careful about how far into the future they let them know what's coming up, because their anxiety will build. And you're talking about summer vacation and it's December. Stop obsessing about summer vacation. But because their time awareness is so short, is so impaired, they're not able to put those things on the back burner in their mind. So it keeps coming up. So those are some things. Another behavioral hallmark for me with time awareness is a child who's task avoidant or has a temper tantrum when they're asked to complete a task, because I'm like, okay, it could just be that they really don't want to take the trash out. But if they were aware of the fact that it's literally 30 seconds out of their life and then they get to go back to what they're doing, maybe it's okay. So it's hard to work from that behavioral standpoint and that logical standpoint with dude, take the trash out and then you can go back to whatever you were doing, if they don't and have that initial, okay, taking the trash out really does take a minute and a half.
The parent part of me is taking in so much information right now. Everything that you just said about the development of time awareness, I think is really interesting. You, because of your specialization, have this framework in mind that goes, okay, around this age, or when a child can do this, then this should come along soon thereafter. For folks who are not as specialized, are you seeing deficits in time awareness age 4, age 5, age 6? When is it that you start to really see oh, this is impacting this person's functioning if they are really struggling with it?
Right. So before school age, because school is a whole nother ball of tricks, families can adapt to a tremendous range of challenges from a child. And it's not until they get into school and they have to put their square peg in a round hole that you start to see the things that are really an issue. So if they are preschool age, I primarily am looking at, because we don't even ask a lot of them task wise. They basically have to do, we're going to brush our teeth together, and then they're kind of shepherded through all those tasks. So they don't even have to be aware of when it's time to brush your teeth or how long it takes to brush your teeth, because all of those tasks are supervised. But so I would be looking in a preschool age child with a little bit of patience. Do they have enough patience to participate age appropriately with other children in play? If it's taking turns, should be solid by age 4. If we cannot take turns, or if we have temper tantrums about taking turns, I would start to look at more time awareness. They don't realize how long it's going to take for Susan to have her turn on the swings, especially when it's a non-specific task, like going down the slide. Okay, you go down the slide and then I go down the slide. We can just continue to line up. But if it's, Susan gets a turn with the toy and then you get a turn, well, Susan's turn with the toy could take forever. So it's very hard to if I'm playing with the child and they're like, okay, I'm going to have a hard time waiting for Susan to finish with the toy. Okay, you might be age appropriate, but if you're having a hard time lining up and taking turns for one of those shorter term tasks, then maybe we're dealing with some time awareness stuff.
Thank you. That was a really helpful example that I know for me, I had never thought about before, but you're right. If you think that Susan's turn could not be 20 seconds, but could be 20 minutes, that's a whole different.
And you don't even have the concept of 20 minutes.
Right.
You just know it's
a really long time. Yeah, it's forever. Yes. It's mom minute.
Yes.
So we move through that. It seems to me that, having worked a lot with adolescents and young adults, it's the increasing demands in society on your time that it feels like we, as family members, as friends, as clinicians, might start to recognize oh, there's a real difficulty here, because it's I'm routinely late for school, or I have a lot of trouble ending the conversation to leave for swim practice on time, or whatever it is.
And if you think about, childhood is very externally regimented anyway. Even up through high school, I have to endure this class until the bell rings, and then I have 5 minutes to get to the next class. You don't really start to prioritize amounts of time for yourself until college, really, or your first job where you're given a task and it's up to you to sequence it, to understand how long it's going to take, and to produce whatever it is you're supposed to produce within a given amount of time. You get practice with that by, writing papers and whatever. But so when you get, and I'm wondering, and since I don't work with early adults, or young adults and late adolescents, if that plays into, I know with my children, I perceived as laziness. There was just like, well, if I don't have a task that needs to get done right now, I'm not doing anything. I'm gaming with my friends, or the room is a disaster all around me. But because it's not room cleanup time, it doesn't occur to me okay, it's going to take me 10 minutes to clean the room. I could just get it done. And I think maybe that's a frontal lobe issue. but so that may be something to, from a neurotypical population to discuss from a cognitive perspective, is you are responsible for your time. And this is why you may not be able to do it right off. You're new to being responsible for your own time as a young adult.
Thank you. That's just a really good point that you just made, because you're right. It's not just about the demands. It's also when you're given a block of free time to some extent in your standard average American household, particularly for the way that we right now tend to raise children. The conversation exists so much about like the over planning, and you're right. We don't have that much downtime.
Yeah.
And then you're having to break down larger pieces of time into tinier bits, which I still struggle with that.
Well, and actually you bring up a kind of a good point in modern childhood, as opposed to, I hate to say when I was a kid, but when I was a kid, because kids are more overscheduled, they can sequence things, but they can't necessarily, they're not in charge of when things happen. So they just kind of bop along until it's time for soccer practice. And I wonder about the impact of screens and cell phones, because we've all done it. We've all lost half an hour to an hour scrolling and not realized how much time has gone by. So I'm wondering if that also impacts their time awareness. Time back in the day, like my father grew up making model airplanes. Could you lose yourself in that task? Yeah, absolutely. He could probably spend 4 hours every afternoon making model aircraft, but it breaks itself into steps naturally. So there is an opportunity to, okay, I've done this part. Lift your eyes, look around, see what's going on, key into your environment and hear what's changed. Whereas now that time can pass with absolutely no change in environment whatsoever, and we're not keyed into it. So we don't even have those external cues to hook us into time a little bit.
Absolutely. Thank you. And then moving forward through adolescence and young adulthood into adulthood, this is where I think one of the places the split between occupational therapy and mental health therapy becomes more obvious. So I have absolutely had the conversation with supervisors where if a client is chronically late, it's so common for that to be interpreted as resistance, quote unquote. Well, then maybe the client doesn't want to be in therapy. Maybe it's their way of devaluing you or the service. And arguably, any or all of that could be true. And I want to hear from you about that through your perspective, knowing as much as you do about time awareness.
Well, there is something to be said for it's hard work. And I know that but even if let's say you feel you're of two minds about therapy. One mind loves it. I feel better after a therapy session, you'd still be looking forward to it. And therefore it would kind of be on the front burner of your brain throughout your day. I've got therapy at 1 o'clock, or you're dreading it, which I'm sure happens. And you're like, oh man, I've got therapy at 1 o'clock. And so it's still part of your mental process of the day. So that's one question. Is it part of their mental process of the day? And that can be applied to therapy or anything. Is that dentist appointment part of are they able to chunk out their day? And some people are not. Some people wake up in the morning and they go from task to task because sequencing is what they do. They're not able to project into time in the future. They can just sequence from task to task. And if that's not, and I think we've all felt that under extreme stress, where you're like, dude, I just have to deal with this thing right in front of me and I can't worry about what's coming up. So that could also be playing a factor is, I can't think beyond what's going on in front of me.
Time blindness is this term that is used, thrown around. Can you speak to what that is and what's actually going on there? Because I know I have absolutely had the experience, whether a client is struggling with being late for therapy or not, conflict. I keep getting written up with work because I am always late when they open up the door. And I had a friend get mad at me because they were sitting there at coffee for 25 minutes and I wasn't there. What is time blindness? Let's start by defining it. And then can you explain it through an occupational therapy auditory lens?
So, I always have to look at things developmentally because issues like that never just like, hey, I was 25 one day and then I started disrespecting everyone's time. Like that doesn't happen. It's always a lifelong thing. So I would want to delve more into, tell me a little bit about, what would be a great example? Tell me a little bit about how you did in school. I mean, those children who are perpetually on top of their homework assignments do quite well. Those children who are always kind of surprised that something was due because they didn't structure their day accordingly. They didn't have that ability to block their time out and make it work for them. That's going to be an indicator of like, okay, you've never been great with this skill. Let's go back even further to if you are young and you have an awareness of time, developmentally, it's kind of developmentally appropriate. Hold on, I gotta start over. I'm not getting there today. Ask me the same question again if you can.
In therapy, we have a client who is commenting that they're routinely late. It's impacting their relationships. We use this phrase of time blindness. Can you explain what that is and what could be happening there through an occupational therapy lens?
So, you don't just arrive one day having difficulties with time. It's a long-term problem for a lot of people. And a lot of people don't have that innate sense of time passage. The example that I love to give is how rhythm grounds us in time passage. My favorite example is a metronome, sweeping, the arm that sweeps back and forth, not the electronic kind, but the old-fashioned ones that went tick, tick and had an arm that swung back and forth. If you were to hear the tick, tick of that metronome and watch the arm swing back and forth, your brain would actually measure that time passage fairly accurately, which is a lot. If you have a well-developed sense of time, you already kind of innately have that. So if you've been spending half an hour doing something, or if somebody says, what time is it? And you don't have access to your phone and you go, I think it's around 2:30. And then you look at your phone, and you're like, oh my God, it's 2:35. That's amazing. You have a fairly established sense of time. If you were looking at that same metronome and that arm was sweeping side to side, but you didn't have the auditory tick, tick, tick. Most brains, it's not a brain glitch. Most brains would not be as accurate in measuring time passage just watching something visually, because your brain measures those gaps between the ticks, but there's not really a gap for you to measure between the sweep of unless in your mind you're like, that would be a tick, that would be a tick. You can do it as an adult, but this is what it is to be mesmerized. When you watch something that continuously moves, especially slowly, without an accompanying sound, think lava lamps or, those little swirly, optical illusions that swirl around and around. That is mesmerizing because there's no accompanying sound. So that accompanying sound just of life is what helps us start to establish that awareness of time. And I'm talking awareness of 5 minutes, not even awareness of like whole weeks passing. But if you don't have that basic 5-minute awareness, it's really hard to arrange yourself to arrive somewhere on time. You don't take into account, okay, I know it's a 30-minute drive to get across town, but it's going to take me 5 minutes to gather up my things. And then, I forgot about I have to go by and pick up milk on the way home. And that's another. So you have a hard time arriving where you're supposed to be. And some people are aware of this deficit and they arrive super duper early. And I think it's a matter of whether or not your default setting is for anxiety or your default setting is for ignoring the problem, just kind of tuning out, depending on what your stress response is.
When you and I had talked about this interview, you had shared about a couple of people who had written about and shared their experience of being time blind. Can you share a bit about that? Because I think it's so interesting and illustrative of what is it like to exist in a world effectively where time doesn't exist?
The extreme versions of this are people with autism, and specific difficulties with autism. And the two that I love to reference because they're so incredibly eloquent are Temple Grandin and Naoki Higashida. They overcame that barrier of communication to explain what it's like to have no awareness of time. Temple Grandin is wonderful about explaining how she doesn't, she thinking in pictures, the title of her book, because things don't happen sequentially for her. A memory will be triggered by an experience that's happening now, and those two things won't have a gap in time between them. So when she makes these associational thoughts, they come instantly, and it takes her away from what's actually happening in that moment. When you keep the continuity of something, that's a time awareness. So she would be almost completely time blind. She used to talk about how she'd have to read, if she was reading something, she has to read aloud because she needs the auditory cue of sequencing the words and staying anchored in the space of the sentence because she's so associational. And Naoki Higashida says the same thing. He says, when somebody tells me not to do something, I don't know how much time has passed and I'll do it again because them telling me not to do something, I think the example was you're doing something that your mom finds really annoying. She may tell me not to do it, but then for me, a day has passed and I just go to do the same thing. But for her, maybe, 5 minutes have passed because he's just not anchored in time the way that we are. So having that kind of impairment and then being told to arrive somewhere on time, okay, but I don't have any concept of time. So that's the extreme version. And I think we all fall on a spectrum of everything. And so people who are not used to thinking in terms of time and are just used to thinking in terms of sequence, first I do this, then I do that, and then I do this, they won't necessarily be able to finish that sequence at the appropriate moment. First I get my shoes, and then I get my bag, and then I get out the door, and then I drive to therapy. But because I don't know how long all of those steps take, I'm not going to arrive at therapy at the right time.
Thank you for so eloquently just describing the wisdom of these two people and what they've been willing and able to share. This is so interesting to me because I'm realizing, I've even had the awareness as a parent that it's make your bed and da-da-da-da. And then I'm like, I've never taught this child how to make their bed. There are all these steps that we go through. Sequencing being a very regimented A to B to C. We're not taking into consideration the amount of time. And then we're also potentially not taking into consideration when Y just sticks itself in there between C and D.
Right. When something throws the sequence off, you're like, well, crap. And then and ADHD, people with ADHD are so prone to this because they think, okay, I'm on my way out the door to therapy, but I could just sweep this hallway really quickly before I leave. It's a mess. And those things just stack up and they lose track of what they were supposed to be doing because they're doing the thing that's right in front of them.
You've mentioned autism. You've mentioned ADHD. you've already mentioned kind of neurotypical versus neurodivergent. Certainly, if we were to pull open the diagnostic manual for mental health conditions, we would see this idea of time coming up in different diagnoses. I mean, if we look at, you mentioned anxiety, if we look at anxiety, if we look at depression, like we may be moving slowly and talking
And I think time
slowly.
stretches out. Mm-hmm.
So there's a lot of grounding in time about the way that we view typical and atypical. When we are in that realm of atypical, I think what begs the question is like, and what do you do about it? Like for the client who is chronically late, who always finds themselves like sweeping the floor and taking out the trash and throwing in that one last load of laundry before they go. And they're like 18 minutes late for the doctor's appointment. The doctor's like, we need to reschedule you. And they're like, no, but I have this thing like that. How, there's how therapists may come up with solutions, which again, I'm not saying that those aren't good or valid. And I'm like, my brain is creating all of these interventions. I'm curious for you as an occupational therapist, like what do you reach for that is probably totally out of our awareness?
All disability or difficulty, for any of my clients comes down to is the time that they have and the space that they have a good enough fit for their capabilities. And that's, that applies to everyone. If you're in a space that isn't conducive, let's say you're in a wheelchair and you're in a non-wheelchair adaptive space, you're not going to be functional because the space is not suited to your needs. The same thing is true with time, but I'm going to put the word time awareness in there and your ability to understand time. And so if you have a time awareness difficulty and you tend to be anxious, I would say that you're probably stuck on time. You understand time in the big sense of like days, weeks, months, but you have a really hard time staying focused on the next 5 minutes. And so your anxiety tends to come in when you're thinking about the future, because you're always thinking about the future. You're not able to stay tuned in to the now and to the next 5 minutes and to the short term. You're anxious about the future, or you're obsessing about the past. You have those people who are kind of outside of the now, and then you have people who can't process those long-term things, the people that can't plan for the future, and they are overwhelmed in the now. They just need to get through this day. They just need to figure out how to get this done. Both of them are really terrible fits for what the person is capable of right now, if that makes sense. So depending on what I would be seeing in the client, I would say, okay, are you obsessing about things that happened 25 years ago? Are you, anxious about something that's not even going to happen for quite some time, or something that you can't control right now? I would be thinking mindfulness. I would be trying to ground them in their body using yoga techniques, breath awareness, focusing on mindfulness, and then perhaps adding a time awareness piece through some kind of cognitive, schedule making, or so that we can kind of map out, okay, you know what? All you're responsible for is this page of your diary, and we're going to take these one at a time, and that future is going to take care of itself. If you are dealing with one of those people who is just harried beyond belief and just, oh my gosh, I don't know how I'm going to get it all done, and I've got 27 things to do in this day, I would be thinking more along the lines of, we can talk about how to say no to things and how to set limits for yourself, but really, let's think long term. Is this going to matter in 10 days? Whatever it is that's got you upset, is it going to matter in 10 minutes? Is it going to matter in 10 years? And try to get them to bring themselves back down. There's a really great book called 4,000 Weeks. And I wish I could remember the author, but it just really encapsulates for people who are very overwhelmed with the to-do list that, basically we're all going to die and it doesn't matter anyway, which is a great lesson, but he says it much more eloquently than I do. So to me, that's, handling the stress that's created between the lack of time awareness and the inability to structure time and the stress that it creates in life, that's going to be, to me, the thing that someone is looking for in therapy. They're looking for you to help them manage the feelings that it creates, not necessarily what's creating the feelings, but the feeling that it creates. Now, if you also want to approach it from an auditory perspective, it depends on, you'd have to break it down into behaviors. But if we're dealing with chronic lateness, for example, alarms on your phone, that sort of thing, but also maybe trying to build some time awareness. For example, if they, you break down this chronic lateness problem that they're having and you realize that they're more of an ADHD type person where they're trying to get too much done before they leave the house, it might be beneficial to combine that with mindfulness and you're going to set an alarm for half an hour before you have to go anywhere. When the alarm goes off, you're going to take 3 deep breaths, and then you're going to turn on some slow music, something to keep you auditorily grounded, something with a slower rhythm, and I don't know, maybe a playlist. And when that playlist is up, it's time to go. But it keeps them from spinning into all the things or it may help with them spinning into all the things that they can get done if they just move faster, because they're not going to be able to move fast enough to get it all done before it's time to leave. So the combination of those things, if it's a younger person, you can, and especially for like the task avoiders and the children who are kind of begrudgingly doing tasks and mom is just tired of fighting battles. Music is wonderful. Look, I just need you to do it for the length of this song and let the child have some say. Do it for the length of this Taylor Swift song that you love to listen to, but that's because they will inherently know how long that is if they've listened to it over and over. So you can incorporate those things. I love a metronome. Doesn't have to be the kind with the swinging arm, but just the background tapping in the mornings for those kids that can't get their butt in gear and get their teeth brushed and all of the things. Just having that rhythm to their morning during those tasks where they need to be, focused and get it done can be really helpful.
It's so interesting to me, this idea of auditory cues grounding us. Because this topic comes up, I think, a fair amount in therapy. And I think it comes up in our personal lives. Like we all know that friend. Like we have that friend that just always late. And my question, before we go any further, if we're using auditory cues to help make determinations about time and our awareness of the passage of time, what happens for folks who are hearing impaired?
That's a great question. I get that one a lot. There is some science to suggest that they do struggle with these concepts more than others. The prevalence of ADHD is higher in the deaf and hard of hearing population than it is in the neurotypical in the fully hearing population. Those children who suffered from otitis media, especially chronically, as infants and toddlers, really struggle with, I can't necessarily say concepts of time, but they have a higher incidence of learning disabilities and ADHD and inattention. And those could be time related, time awareness related. So there is some evidence to say that if your hearing is impaired, these things will be impaired also. The question that I often get is, well, what about deaf people? They can't hear, and those congenitally deaf people, and our ability to sense that rhythm just comes in different forms. At that point, they definitely experience the in utero rhythm. It was just felt because they were probably much more sensitive to vibration. And then as they developed, they can still feel vibration. They can see visual patterns. I think it's just harder for them to establish the space between those patterns. That would be hard for me to know because I've never been deaf, so it's hard for me to know that. But yeah, I think the difficulties that I see clinically usually there's no red herring in every child's medical folder, but I see a lot of children with chronic allergies, a lot of children who were born breech, or born prematurely, which means they were missing some of that chance to develop in utero before they had to kind of experience the big loud world. Chronic ear infections are just, I mean, and sometimes for those kids that managed to have an ENT that got them PE tubes, pressure equalization tubes at a very young age because they had chronic ear infections, I see an improvement when they get their PE tubes, and we start to make better progress because they can establish skills that then the information they're receiving doesn't change once the PE tubes are in. But if they're constantly feeling a change in inner ear pressure or middle ear pressure and how that affects what they hear, it's hard for them to establish that database.
Thank you. That's very interesting. And I appreciate what you said in terms of vibration potentially taking the place of auditory input. Just because I'm curious, do you happen to know if there are devices that accomplish that for people who have hearing impairments that are kind of like a vibration metronome?
Yeah, I'm wondering, I don't think anybody's ever approached it as a time awareness issue where they're like, you didn't get enough rhythm. I do think that that people who are deaf and hard of hearing seek out vibration, not in a dysfunctional way, but this does make me feel good. It's a hilarious story about a hard of hearing guy. I wish I could remember who it was, but he was in the car and his mom was in the store and he's in the car by himself and he's got the radio on and he's just loving what he's feeling. You know, he's got it up and he can feel the vibration and people are driving by and they're like staring at him and he's giving them the thumbs up like, yeah, this is great music, isn't it? His mom gets back in the car and goes, why is NPR up so loud? But I think the patterns in speech, especially at NPR where there's nothing else going on, it's just somebody talking into the microphone like that skit in Saturday Night Live. And like that type of rhythm probably felt like something that gave him a little neuro tickle. So I think they do seek it out. And I think they do, people who are deaf and hard of hearing do use it. But the question that I get is, well, how come they don't have these time awareness problems? And I think it's because if they're congenitally deaf, they find new ways to get input. And even if they have a degraded hearing loss over time, they begin to lose their hearing as a child and then it's slow. It's that incremental loss that they learn to adapt to as it goes. It's the children who things sound different from one day to the next. And there's too much variation in the information that they're taking in auditorily for them to be able to establish consistent rules for the way things should sound.
That makes sense. It becomes scrambled.
Yes. And as dealing with adults, you have no idea or even a way to tell if this was a potential impairment. I mean, you might be able to ask a child, so did you have a lot of ear infections as a child? And they may be able to fill that in for you, but you still don't know what the honest sequelae of that was. But it's a pretty good guess that maybe they could benefit from auditory therapy or the use of some kind of auditory cue to help anchor them in time.
Thank you. I appreciate you addressing that. When we are working with people who struggle with time awareness, you had already mentioned a couple of interventions about like slower music or a metronome or listening to this particular song. What are other interventions that you found to be helpful? I mean, there's the list making, there's the scheduling, there are the things that we do, kind of more of a hands-on case management perspective in therapy. But, the idea of any of us essentially floating around in the world without time to ground us is really disorienting. You had mentioned using song or background noise as a way to kind of help ground. Just that intervention seemed to make a difference with adults. We all use music, even as adults. I mean, when you go to the gym, you turn on that. You're not gonna work out to Beethoven. You're gonna work out to Beyonce, and those choices alone
are what we use when we're aware of what we need to get done. If we know how to use music, like if music occurs to us. For some people, it doesn't occur because they don't, they prefer the quiet, or they're worried that it'll interfere with their thought process to have music on. I know for myself, can't study if I'm listening to music and it has lyrics. I can't shut the words out. But I do know that if I'm studying and I listen to soft background music that has a little bit of a beat to it, I do much better. But that takes a lot of self-awareness. So I think you can definitely use music as a really valuable tool, especially in this day and age where music is so portable and so available so easily, that, I would definitely use it. It's so socially appropriate to use it with adults.
I appreciate that you just brought up beats. Can you speak a little bit about what a binaural beat is and why that's something that we're hearing more of? And I'm curious if it's something that you would use potentially with children or adults to provide that auditory grounding.
So it would be fine with children or adults. And actually, there's a couple of things that are so accessible now that I'm kind of blown away. So you can get binaural beat music, and it can be the background to any music that you prefer to listen to. Really, I think they have so many different binaural beat recordings out there now. But essentially, you've got that stereo sound. Your right ear and your left ear hear the same music, but there is a slight time delay between your right ear and your left ear, so that the sound waves that you're hearing reinforce each other rhythmically. So you're listening to, let's say, a sustained note of music, but because the sound waves are off by 4 cycles per second, 4 times a second, those sound waves kind of crash into each other. And so you very subtly hear 4 cycles per second of a small background beat. It's almost imperceptible. And your brain does, however, register it. And what it's designed to do is binaural beat technology keys into the natural neurorhythms of your brain, your brain wave states, to enhance. If you're concentrating, you're going to be in beta wave states. That's when you're kind of in the flow of things. So you're listening to music with the same cycles per second as beta waves. If you are trying to sleep, that's delta and gamma waves. So you're going to maybe put on music and try to fall asleep to something that entrains that delta wave slower state that you want your brain to be cycling in. So it helps you achieve that state. So that's one, and those are available, Spotify, YouTube, whatever. You do need to listen to them in a stereo situation though. So you've got to have like headphones on.
That is so interesting. Thank you. Because it's something I think I heard about binaural beats probably 15 or 20 years ago. And as you were talking about this, it's like there's that same thing again. It's like that this stimulation is helping our brains kind of hum to a particular rhythm. It's
rhythmic. I mean, the way we tend to think of taking in sensory information and taking in our environment in this continuous flow, but really our brains take in sensory information in tiny packets that happen multiple times a second. So it's almost like when you're watching a film and you see the film as continuous, but it's individual pictures that are so close together you don't see the gaps. Well, if that film speeds up, it kind of raises our anxiety or raises our alertness level or raises our awareness. That's the faster brainwave state. But the slower brainwave states, if the film slows down, it takes us into that deeper, there's a bigger gap between one picture of the film and the next. So I think it's fascinating that we can kind of cheat a little. It's a little neuro hack, and we can entrain our brain to do what we want it to do. The other thing that I find really fascinating, and I haven't had a chance to play around with, but is super important when I treat kids, that I think is now a little bit more commercially available, is when I'm working with kids who have depth perception issues, reading issues, movement through space issues. Not that any of these are specifically time related, but it's a good illustration of what sound does for us. I will help them by playing an auditory track that was recorded in nature, but it's recorded with two different microphones set on one side of the head and then the other side of the head. So if a sound comes from the right, it hits the right microphone and then the left microphone. So in the headphones, it does sound like the sound is coming from the right. And so your eyes are kind of drawn to the right. And this is how we coordinate initially, developmentally, coordinate around our core and kind of get our environment. Knowing what's in our environment and how far away it is this sense of where sound is coming from. That's kind of an interesting technology to have, but not everybody has access to those recordings. However, the Dolby Atmos recording, Dolby sound has been around forever. But it's always been in stereo. You have your right channel and your left channel, and then the two sounds come into your ears, and, it sounds more rich. It sounds more like you're immersed in the environment. Well, what they're having now is music that's recorded with 12 different channels. And even though you can listen to it on a headphone that's, your right ear and your left ear, you're getting 12 different possible locations of sound. And it makes for a much more immersive experience. And I'm wondering if that also would have a greater effect on people who are using rhythm to establish time, who are using music or using sound to establish mindfulness, to help in mindfulness, because it gives you more of a sense of where you are in space and hopefully in time. And it's just more, I haven't had a chance to play around with it, but I just think it's exciting that it's out there.
It is. It's very exciting. Thank you for sharing about it. When it comes to, we'll say, working with teenagers, young adults on developing more time awareness, how well does this work? Like getting into the realm of neuroplasticity, how long, is this really doable to develop workarounds and to improve somebody's time awareness?
So my experience is all with kids. And so I will say, when I'm treating a child who is struggling with time awareness, and sometimes I'm not always able to know that, oh my gosh, that behavior is because they have a difficulty with time awareness. It's only when I address it through auditory therapy and it improves that I'm like, oh, I had no idea that that's what that was. The example that I like to use is I was working with a young man who had a litany of difficulties. He was on his second time through, he'd been through kindergarten twice. He was on his second pass at first grade, and he just couldn't remember information. You could go through the alphabet with him, and, one day he'd be able to sing you the ABCs. He might even identify a few, but then the next day you'd be like, what's this letter? And he'd look at the letter G and go, A, B, C, D, E, F, G. He'd actually have to sing the song. That information that he knew yesterday was just gone. And so that was kind of what we were working on when, his mom came to me and was like, we really struggle with, he'd always been kind of playfully aggressive to his brother and the dog. And I think it was kind of a call and response thing for him. Like, I'm going to poke the dog and then the dog is going to growl at me, or I'm going to poke the dog and the dog is going to run away. It created a sequence of events. His mom said, he's doing much better with that aggression unless we're in the car. We get in the car to go somewhere and he pinches his brother and his brother cries, and I can't monitor him because I'm driving. What can I do about this? And as we got further into some auditory therapy choices that I knew were time related, it was a very rhythmic selection that we were listening to. I knew that it was going to affect his time awareness. What I didn't realize was that it was going to affect that behavior. Within a couple weeks, his mom was like, "Oh, we can do car rides now. We talk about his day at school. We talk about what I need to get at the store," which he couldn't do before. And then he doesn't poke his brother the whole time. And I was like, okay, what changed? And as I'm thinking, okay, the poking of the brother created a sequence of events because the car ride had no sequence. Like, he was used to going from one thing to the next, and his brain didn't mark how long it took because he didn't have time awareness. So he knew that car ride was going to take a really long time. What can he do to entertain himself? He can poke his brother. And now he knows the car ride only takes about 10 minutes to get to the store. And mom's asked me a question and I'm keyed into this moment. I'm keyed into what we're doing now. And that 10 minutes is not unbearable anymore. I'm making huge assumptions here. All I know is the behavior improved while we were working on the time awareness, and this is a possible explanation.
I thank you for sharing that example. And I think in thinking about that relative to this idea of like, does it get better? I think your answer is yes, because it improves our awareness of these chunks of time. And just that helps us better manage various chunks of time. You've talked about sequencing a little bit. Before we wrap up for today, I want to go back to sequencing. So sequencing is our ability to put things in order to, we'll say, complete a task, just as an example. How is that impacted in people that are neurodivergent, that have autism, ADHD, XYZ?
So, when we're sequencing, when we're doing any task has a sequence. I mean, there's a beginning, middle, and an end to everything. But for those neurodivergent people who don't think in terms of time, they would have a hard time doing beginning, middle, and end because they don't think in terms of sequencing. And a primary example is just speech. In order to understand an entire sentence and the meaning behind it, your brain has to be able to sequence all of the sounds that you hear. So if you are listening to someone say, we're going to need to go in 5 minutes, so grab your shoes and grab your bag. Okay, processing all of that requires your brain to know like the sequence of events that you heard, all of the words that are in there, and if it took longer than 3 seconds to say, it requires a different part of your brain to process. It moves from working memory into short-term memory. Like, oh, you said I need to do this, that, and the other. It's no longer a working memory task. So having an inability to follow that sequence of thought makes it very difficult to understand the concept behind the whole sentence. If you're just listening to the flow of, it's as if you're just listening to the flow of the words, but because they're not connected one to the other, you're not getting the concept behind it. And I think this is actually what happens for a lot of nonverbal kids with autism, is the sounds are just sounds. They're not connected to ideas.
Thank you. That was actually helpful to help understand this idea of sequencing and then where it may be different and there may be deficits for folks who have autism or ADHD and how to kind of operate within that space. Because as we've talked about, I think this comes up quite a bit. And it's also such a source of embarrassment of like, why, I mean, my goodness, I've had that conversation. Like, why is it so hard for me to just do this? I keep getting in trouble. I just, So your clients are frustrated. I mean, they're okay. So I would try to harness that and say, okay, are you willing to try something that doesn't seem related at all to what is actually frustrating you? And then broach, okay, we're going to map out your time a little bit. Well, you can do the sequencing visually, but also let's talk about using music. Let's talk about sequencing your day with music. Let's talk about having auditory cues on your phone to help you key into. And you asked earlier, is this a doable thing? Neuroplasticity tells us that it is. I'm not sure how long you need to practice it for it to become in tune, to become innate as an adult, just because we all have different thresholds, I think. There's the whole 21 day, like, oh, you need to do a thing for 21 days before it becomes a habit. But if someone is using a method of auditory cues, try it for 3 weeks. Just be like, let's try it for 3 weeks. And encourage them to be honest with you if they fall off the wagon. They need to be honest about that, but then you can reassess. The other tool that I might use, and I know we're
I should have thrown this in earlier, is there are a lot of time mapping software out there, and there's a lot of tools for, go through your day and just, for 1 or 2 days, every 15 minutes, categorize that 15 minutes. Were you spending it taking care of yourself? Were you spending it in leisure? Were you spending it on work? And then it gives them a little bit more of an idea of like, okay, you feel like you don't have enough time to get where you need to go, but let's look at what you're actually spending your time doing. And that could be something, I'm sure there's an app for the phone that would help them do that. So if you need to approach it from a cognitive perspective, in order to get the buy-in of, okay, we're going to talk about adding an auditory cue to your phone that goes off every 15 minutes so that you're able to key into what you should be doing, or know that, the alarms are set so that you know what you're supposed to be moving into. Because I think you're right. I think a lot of people feel like it's juvenile to constantly have somebody reminding you to do something.
Well, right. And it's, as you said earlier, of like, a lot of times if people struggle with time awareness, then some pretty unkind words are used to them and about them. And this sense of, why do those people get it and I can't get it no matter how hard I try, or I'm just used to disappointing people, or people getting mad at me, or my mom used to always say, or whatever. But so I appreciate you coming on today and not only explaining what might be happening, but also giving us some tools so that we can try to make this better, because ultimately this is about satisfaction in life and like functional improvement. And this could help make things a lot better for somebody across many different domains. For our listeners who want to learn more about what you've talked about today, Robin, are there any particular books you recommend? I recommend my own, Sound Advice, How to Help Your Child with SPD, Autism, and ADHD from the Inside Out. The book Felt Time by Mark Bittman is just an interesting look at how we develop time, what it means to us. If you're more interested in the auditory function part of it, there's a book called Of Sound Mind by Nina Kraus. That's just, it'll blow your mind, because she's doing things where you're like, yes, this makes so much sense to me. And then the book I mentioned, 4,000 Hours, and I'm sorry, I can't remember the author right now. So wonderful, as far as just, great to recommend to a client who's just feeling overwhelmed and struggling with time management, not so much time awareness, but time management. And then John Kabat-Zinn and all of his mindfulness stuff. But there's so much great mindfulness stuff out there that if you feel like they need to delve into that, there's a lot of good stuff out there. Fantastic. And for our listeners, again, Robin Abbott here. Can you please also share what's the best way to reach you if we want to learn more about your work?
You can reach me on my website. It's booksoundadvice.com. And my email is on there.
Fantastic. Robin, it is so helpful to have someone come on and share a different perspective. I'm really grateful, because we only know what we know.
and we don't know the things that we don't know.
Right. We don't. If I'm being honest, like, occupational therapy is one of those things that I had wondered about for years, going, I wonder what that is. And then now I learn more and more about it. And I go, I really need to know more about this, because I can see how much this intersects with the work I'm doing. Thank you. This has been so helpful for me. I really appreciate you coming on to share your knowledge with us.
Well, thanks so much for having me again. It's really fun every time.
You've just finished listening to another exclusive Continuing Ed podcast by Clearly Clinical. If you like what you just heard and you need Continuing Ed credits, please visit us at clearlyclinical.com to check out our one-year membership, where you'll have access to our growing library of Continuing Ed podcast courses. Clearly Clinical, where our goal is to help you learn, grow, and shine.